Fox 45. You're watching Dayton 24/7 now.
November is National Diabetes Awareness Month, and I'm here with Dr. Ron Supanath from Buckeye Health Plan to talk all about diabetes awareness and, of course, prevention. This is a huge topic. This is a big deal. Why do symptoms of diabetes, or I should say probably type 2 diabetes specifically, go unnoticed?
Well, the most common thing is actually to have no symptoms at all. And so clearly people will not notice that if they have no symptoms. If they do have symptoms, they can be varied and they can mimic a lot of other things. So things like increased thirst, increased urination, increased appetite, and weight loss despite that increased appetite. Fatigue, a very vague symptom, is common. And then burning or tingling in the hands and feet can occur.
What are those symptoms often? The fatigue, the blurry vision, cuts and bruises that are slow to heal, or some other things, but the tingling, how do those symptoms relate to type 2 diabetes?
It's a great question. So diabetes attacks the entire body. It affects every organ. And so the burning and tingling in the hands is caused by the diabetes damaging the nerves.
Oh, and then obviously the increased urination, that would be a similar situation with the bladder then?
Diabetes does damage the kidneys and you can have kidney failure.
Oh.
And of course, blindness can occur. You mentioned vision changes. But the increased urination is because it changes how your body concentrates sugar, and so it's not concentrating it. You get more sugar in the urine, and that can cause the increased water to go through the urine as well.
Interesting. I did not know that. So how can you reduce your risk for type 2 diabetes?
Great things can be done, but they're not easy things,
Right.
unfortunately. Following a healthy diet, especially adding fruits and vegetables to your diet, is great. Losing weight if you're overweight, and more than half of Americans are overweight, so weight reduction is important. Having a more active lifestyle, so having some kind of physical activity nearly every day is important. Quitting smoking if you're a smoker is big. So smoking actually increases your risk of diabetes, but also if you are a smoker and diabetic, that magnifies and multiplies the risk of damage to your organs. You can imagine if diabetes harms your heart and smoking harms your heart, you're using both, and it's just really bad for you.
So when you do get that diagnosis of type 2 diabetes, why is it critical, you think, for folks to have support?
Well, it is a complicated disorder, and the things that we just described are not easy to do. So having support not only from your family and friends, having support from your primary care physician, and then even from your health plan to help guide you through understanding all the aspects of the disorder, understanding all the healthy habits that you need to really adopt, and then supporting you to actually do those things.
When you talk about the healthy habits and trying to adopt healthy habits after a diagnosis, can you really be cured from type 2 diabetes? How does that work exactly?
Excellent question. So we have pre-diabetes, and we can prevent or delay that developing into diabetes. Once a person has diabetes, we don't really consider it a cure, but you can dramatically improve their outcomes and reduce their risk of developing those serious health consequences like heart disease, kidney disease, vision loss.
That makes sense. Okay, well, for more information on diabetes, you can always head to BuckeyeHealthPlan.com. And Dr. Ron Supanath, thank you so much for being here this morning, breaking this down for us. I was always curious about if you could cure it, but I guess that was a very great question or a great answer, so thank you so much.